So continuing on with the remainder of the axial division of the skeleton, we'll discuss the thoracic cage. Now, the thoracic cage is a bony structure that is also known as the bony thorax. Its elements include the thoracic vertebra, which are located on the posterior side of the thoracic cage, the ribs on the lateral aspects of the thoracic cage, and the sternum and the costal cartilages that are located on the anterior side of it. Now, the costal cartilages are bars of hyaline cartilage that secure the ribs to the sternum, or I should say most of the ribs to the sternum. Not all ribs have costal cartilage associated with them, but a good majority of them do. So the functions or the purpose of the thoracic cage is to protect things like the soft organs that are inside of the thoracic cavity. So these soft organs include the heart, the great vessels. These are that emerge from the superior part of the heart. So these would be things like the aorta, which is the body's largest diameter artery, as well as the superior and inferior vena cava, which are the large veins that return blood from the body to the heart to be sent back to the lungs again. And of course, we have on the lateral aspects of the thoracic cavities, we have the lungs. And so we've got several very important soft organs that need to be protected within the thoracic cage. The thoracic cage also provides a means of structure and support to support the pectoral girdles. These are the clavicle and scapula bones that are going to be uniting the upper limbs with the axial skeleton. And so the thoracic cage provides a support for those. And it also provides attachment for muscles of the head and the neck as well. So let's look at some of the elements of the thoracic cage now. In a previous lecture, we discussed when we were talking about the vertebral column, we discussed the thoracic vertebra. So let's focus our attention on the two that we have not hit very heavily yet, and those would be the sternum and the ribs. So let's start with the sternum. So the sternum is a bone that composes, as we discussed earlier, the anterior aspect of the thoracic cage. And its location is actually kind of convenient because it, to me at least, it sort of vaguely resembles a necktie. And so it's in kind of the proximity of the neck. And so its shape is kind of appropriate for that in that regard. It is a flat bone, even though it is longer than it is wide. It is also compressed or flattened in the anterior-posterior direction. And so for that reason, we classify it as a flat bone. It's approximately 6 inches in length from the superior to inferior aspects of it. It's composed of 3 pieces. These pieces are the manubrium, which is the superior part of the sternum, and it kind of resembles, going along with that necktie analogy, I think the manubrium kind of looks like the knot in a necktie. The manubrium's job is to support the clavicles, which you don't see here. There's a little notch here called the clavicular notch, where the clavicles would articulate with. So the manubrium supports the clavicles of the pectoral girdle, as well as the manubrium is a location where 2 of the 12 pairs of ribs will articulate with. Moving inferiorly, the body forms the bulk of the sternum. This is where most of the ribs that actually attach to the sternum will attach to. The body has small notches on it, which receive the costal cartilages from those ribs, because the ribs don't connect directly to the sternum. That is, it's not a bone-to-bone connection. Rather, all of the ribs that do connect to the sternum connect using these linkage bars of hyaline cartilage, and that hyaline cartilage is what we refer to as costal cartilage. We also see at the kind of moving down inferiorly to the most inferior aspect of the sternum, we have a small little pointed structure that's called the xiphoid process. Its name means sword-like because its shape kind of resembles the blade on a medieval sword. It's typically made of hyaline cartilage when we're young, but it tends to become fully ossified and converted into bone tissue by about middle age. So it's about age 40 or so that we see that the xiphoid process becomes fully ossified or fully converted from cartilage to bone. The xiphoid process serves as an attachment point for a couple of abdominal muscles that we'll take a look at when we get to the skeletal muscle anatomy in Chapter 10. A couple of major landmarks from your lab list on the sternum. Superiorly, at the very superior top aspect of the manubrium, we have the jugular notch. And the jugular notch is an important landmark. When we get to A&P2, we'll discuss blood vessels, but the jugular notch is a place where the left common carotid artery actually branches off of the aorta. The aorta is the main artery that comes out of the heart, and from there, smaller arteries will branch off of the aorta. So the jugular notch is one place where the left common carotid, or marks the location where the left common carotid artery branches off of that aorta there. The jugular notch can actually be felt or palpated. So if you kind of move your hand or your finger down the middle of your neck, you'll eventually, right where your neck kind of meets your chest, you'll feel this little U-shaped notch there. It's very prominent, and that is the jugular notch that you're palpating or feeling. The second is actually a cartilaginous joint that's called the sternal angle, and this is a joint that sits between the manubrium and the body of the sternum. And this is actually a cartilaginous joint that behaves like a hinge, which allows the sternal body to swing anteriorly when we inhale, and so that allows the thoracic cage to expand in volume and allows us to draw air into our lungs at the same time. The sternal angle can actually be felt as a horizontal ridge across the front of the sternum, and again, it's where the manubrium joins the body of the sternum. So that is the sternum as far as its structures and functions are concerned, major landmarks there. Let's now turn our attention to the ribs. The thoracic cage has 12 pairs of ribs, so we have 24 ribs total. 12 pairs of ribs, and these ribs flare out laterally from the sides of the thorax and form the lateral walls of the thoracic cage. Now, all the ribs are attached on the posterior side of the thoracic cage to thoracic vertebrae. So that is, every single rib is attached posteriorly to the thoracic vertebra. These ribs then curve anteriorly and slightly inferiorly as well. So that is, they curve forward and a little bit downward towards the anterior side of the body from their attachment point on the thoracic vertebra. There's a couple of different categories of ribs, and these categories depend on how the ribs attach to the sternum or whether they attach to the sternum at all. In the case of pairs 11 and 12, they don't attach to the sternum in any way, shape, or form. The 7 superior pairs of ribs attach directly to the sternum by their own little bars of costal cartilage, and that's what you're seeing in blue here. And these ribs are called the true ribs because they connect directly to the sternum with a bar of costal cartilage there. The remaining 5 pairs of ribs are called false ribs because they either attach indirectly to the sternum, in the case of rib pairs 8, 9, and 10. So you see that they do have ribs 8, 9, and 10 have cartilage that comes off of their kind of distal end here, but that cartilage fuses into a single bar and connects to the sternum through the same cartilage that connects rib 7 to the sternum. And so these guys connect indirectly to the sternum. Pairs 11 and 12 have no attachment to the sternum at all. That is, they protect the posterior side of the body, but they don't really make any direct connection with the sternum. And so for that reason, pairs 8 through 12, or rib pairs 8 through 12, are referred to as the false ribs. Let's look a little bit at rib anatomy from your lab list. So ribs, or I should say typical ribs, are classified as flat bones. Yes, they are longer than they are wide, but they are also flattened in a single direction. And so they are classified as flat bones. Here we're looking at a lateral side, the lateral side of a single rib. So these are the thoracic vertebra, which carry our ribs. You can see the rib projects anteriorly and a little bit inferiorly as it makes its way forward towards the sternum. The main part of the rib that you're seeing here, or a good majority of the rib, is simply referred to as the shaft of the rib. Now, nearest to the thoracic vertebra, we have a couple of little bony expansions or projections. One of those is called the head of the rib, which attaches to the body of the thoracic vertebra here. There is a narrow neck region, and then we also have, a little bit distally to that, we have a tubercle. So the head is the head of the rib, as I mentioned, is a bony expansion that articulates with these thoracic vertebra here. The neck is a narrow region that's just distal to the head. So as we make our way kind of anteriorly from the head of the rib, there's a narrow region here that's referred to as the neck of the rib. And the tubercle is actually a small rounded knob or projection that articulates with the transverse process of this same numbered thoracic vertebra here. And so in the cutaway diagram here, you can see this little transverse costal facet on the transverse process of a thoracic vertebra. You can't see it on this one because the tubercle is making contact with it, but that's what the tubercle of the rib makes contact with. So it makes contact with the costal facets on the body, on the bodies between two vertebrae, and it also makes the tubercle of the rib, or I should say the head of the rib makes contact with the costal facets on the body of the vertebra, while the tubercle of the rib actually makes contact with the transverse costal facet that we see on the thoracic vertebra.